Happy Self-Care Sunday. I'm excited for our next guest and welcome again to Sunday Solutions with Body and Mind Solutions. And so our guest for this day is Miss Ideally Rikanja, and she is a physical therapist who's been in practice for about 2 years. And one big announcement she has is that she's also mobile. So she's in the Los Angeles area, but an enhancement to her service is that she is a mobile physical therapist. And I think that is awesome. You don't hear that too often. So let's go ahead and bring you in. Welcome to Sunday Solutions with Body and Mind Solutions. Ideally, how are you?
Good morning. How are you doing? I'm so excited to be here.
I'm happy to have you, and I'm doing amazing. I'm doing real good. Thank you for joining me, by the way. It was last minute, so
Yes.
I do appreciate your time.
No, of course. I'm very excited to be here, and I'm just very happy to see the journey that you've been on. And yeah, I'm very excited to collaborate. We go way back. So,
Yes, we do.
yes.
Thank you for that.
Yeah.
Okay. So I always just get right into it. And we're going to start off first with what inspired you on your journey as a physical therapist, your educational background, just all those things that have gotten you where you are today.
Yes, ma'am. Okay, so my journey through physical therapy actually started probably my freshman year of high school. I always knew I wanted to do something to help others, to give back. I was always very interested in the human body and how it worked as well, but I didn't really know what that would be. So I started to kind of be interested in physical therapy after I was involved in sports medicine on campus, and I've always been a student athlete. So, we're always in the sports medicine room, things like that. So I became interested in rehabilitation. And then it was my junior year of high school when I got injured. I had to get surgery, and I was getting recruited by volleyball teams at the time, for at the collegiate level. And I had to go through an extensive amount of physical therapy for about 6 months. And it was at that point that I realized that that's what I wanted to do. I paid attention to just the holistic approach that physical therapists had. I felt like they have a very unique lens in the healthcare system. And I shadowed there where I was, Kaiser West LA. And then I went on to undergrad at Xavier University of Louisiana. And because of my physical therapist and the work that we put in, I was able to play there for all 4 years.
Oh, yeah.
And then, yeah,
I remember
so
that. Yeah, congratulations.
yes,
I remember that.
yep. So shout out to Dr. Evan Williams at Kaiser West LA. He got me right, and it was definitely a mental journey as it was physical. So I became just very enthralled with that whole process, and I went on to found the pre-physical therapy club at Xavier because we didn't have one, and that ultimately led me to USC, where I completed my doctoral degree in physical therapy, and now I've been practicing since 2023. Thank you.
That's amazing. I love hearing all of that. It's like you connected the dots perfectly.
Mhm.
Um, wow.
Absolutely.
Yeah, some of that process I had completely forgotten about with you.
Time goes by fast. I know.
Mhm. So that's great. So using your own experience because of an injury, that kind of ties into the next thing that I wanted to go into, just what the basic benefits, if you had to describe physical therapy for a person, what those basic benefits look like.
Yeah, absolutely. The basic benefits are improved mobility, improved strength, I would say enhanced performance. All those things are basic. And then physical therapy, as most people know, but some people don't, falls under so many different categories. So it depends on what you're actually getting physical therapy for. So my current caseload right now, just at a basic level, is pretty much half neurologic patients and half orthopedic people who have orthopedic conditions. So the goals will look different, but the mobility, strength, and enhanced performance are pretty much the key to all of them.
Okay, so we know from your experience as a student athlete playing volleyball, injuries can occur.
Yes.
And I know that you'll have patients based on that. What about preventive? So if I'm an athlete and I'm trying to prevent
Mhm.
experiencing an injury at all costs, if possible. What are some of the things, if I were to come, hey, to see a physical therapist, what could you do, or what are some of the techniques, modalities that you have for that?
Yeah, absolutely. In terms of injury prevention, now we're talking about sports specific injury prevention. There's so many different things. So one of my main takeaways from PT school, specifically as it pertains to training, running, things like that, is you want to get in shape to do those things, not do those things like run, jump to get in shape. So
Mhm.
you want to have the base of having a strengthening program with progressive overload. So a physical therapist definitely can help you out with that. In addition to, a physical therapist is really an analyzer of the body systems. So we look at everything from head to toe to see if there are any deficits that other professionals, such as personal trainers, may not be able to see right away. Although there are some very skilled personal trainers out there, so shout out to them. But physical therapists are the experts in movement analysis. So, in terms of preventative medicine, we're able to identify those deficits and then give you specific exercises, stretches, balance things to help you with your training, depending on your sport for sure. If you're a volleyball player, you need to be doing specific injury prevention with plyometrics and like eccentric loading of the calf for all those landing um, jumps that you do. So yeah, it just depends on your sport, but yeah.
So I'm glad you said that, because even at, like, in my practice, so as a massage therapist, you can, when you have your assessments and conversations with clients, and you kind of get an understanding of what they're doing on a day to day, who they are working with, like you mentioned, trainers, right? So
Mhm.
there are a lot of times when we have to really take a look at professionals staying in their lane, if you will.
Right.
When you I speak to a client and it's, oh, well, yeah, my trainer gave me a massage.
Oh yeah.
How?
Yeah.
And
Yeah.
then I'm like, oh,
Yeah.
and they're also certified as a massage. Well, I'm not sure, but and so then that conversation comes up. So I'm just kind of glad you pointed out um, the role of the physical therapist,
Definitely.
while also acknowledging, yes, we do have some great professionals in these
Mhm.
situations, but this is the scope of what I do and what should be done. So yes, I appreciate that, because that does happen. And I've always just been big on, I stay in my lane. If
Yeah.
I'm,
Me too.
I stay in my lane. Like,
Yeah.
that cause so many problems, for people. And it's okay to work with other professionals, which is going to go
Mhm.
into our next topic in question about how you work with other, whether it's massage therapists, if it's athletic trainers, just what that looks like in your current practice.
Yes, absolutely. So I haven't had the opportunity to work directly with athletic trainers yet, although I do have some colleagues that work with athletic trainers all the time. That's more so PTs that are in that direct sports background. I do have opportunity to work with some outstanding massage therapists, in particular in the Los Angeles area. Her name is Natanya Goldberg. And what we've done is, if she has a patient that has, say, a chronic issue, like right now, there is someone who she referred to me who has chronic low back pain, and she's done an outstanding job at being able to manage their systems through fascial work, and she also does roughing. So she's
Mhm.
looking at their whole system and figuring out where their impairments are, but more so from like the muscle and fascial perspective. And then she's asking me to now observe their movement and look at their strength and things like that. And then we collaborate, of course, with the consent of the patient or client. But they usually love it. They always love it. Actually, we've had about 5 people that we've seen back and forth. But what that looks like is, one of us will do our assessment or evaluation first, and then we'll communicate, and we will share insights, and then get the person better. So we've had success with that, and it's really nice to have this this interdisciplinary model. I
And
think that it makes the patient and client feel like they're being heard. And there's always something that they'll say to one of us that they don't tell both. So it's nice to have that perspective.
yeah, I enjoy that. I think when you can find other professionals that you can work with for the to get the best result for your client,
Yeah.
yeah, you're putting their needs first.
Mhm.
And it's okay if you don't know, because there's always going to be somebody else where you can go and get that information. The right person is going to be there, and not trying to take it all in as an individual on our own. So
Right.
yeah, I respect that when people are okay with seeking out assistance from other professionals who know that's what they do. and
Absolutely.
and yeah, you get the best, you put your client first. So I appreciate that as well. So with your mobile practice, do you also incorporate with the massage therapist that you're working with? Do they go out and do, okay, good.
Yes, yes.
Love
So
that.
right now she is based in Playa Vista, and we
Mhm.
met at my previous job. So she has a space in Playa Vista and she has another space in Santa Monica, but when she has availability, she will go into the patient's home, or if I'm seeing them mobile, I will send them to one of her two practices. Mhm.
That's nice. I love
Yeah.
that
Thank
collaboration. So
you.
for any other professionals that are listening to this, take notes. That's good.
Yeah, and then can I say something else too?
Oh,
So
absolutely. Yes.
I on Wednesday I met with another one of my former coworkers, and she's an occupational therapist, and
Mm,
now she's seeing someone who I've been seeing now for about a year and some change, who needs just some help with like some executive function things and organizing and stuff. And this person who was my patient didn't even know that occupational therapists have the ability to help with that kind of thing. So they've been having sessions now for about 3 weeks. So hopefully, we can tie it all together to have like PT, OT, psychology, massage, like all of that, even if it's not an official practice, but just some type of network or something, and including you in the South too, just to
yes,
kind of
I love
have the people move. So yeah.
I love it. You're already doing it. It's already happening, and it's going to continue to grow.
I'm excited.
Yeah, I know that 100%. It's going to continue
Thank
to
you.
grow. I'm happy to hear that. And I have a lot of massage therapists that I work with as well that I'll make sure with. I know they'll be watching this, and we'll get your information at the end, a way
Mhm.
people can contact you and find you on
Absolutely.
media platforms. Yeah. So we're doing a lot of speaking about our, patients and clients,
Mhm.
but what does self-care look like for you? Like what do you do to maintain that self-love and just feeling your best for your clients?
Yes. Okay. I love this question because this is something that I openly and actively am working on. I think that, I mean, I've been in school most of my life,
Mhm.
and I've been a person that's been very on the go and goal oriented. And so for me to thrive in structure and routine, and then to then now rely on myself to have that, versus before in my life with volleyball and everything in PT school, it was very like externally structured. So that's something that I'm working on right now. But what I've learned is for me personally, self-care is really about like discipline, and but compassion too. So I tried the whole self-care thing and relax without structure. It doesn't work for me. Because I need to do certain things in order to take care of myself, as opposed to being free flowing. And there are some people that thrive in you know free flowing and things like that. But for me, I kind of like to structure things in, and then if I don't do that, then have compassion for myself, and then figure something else out, or just allow myself to just be. But yeah, just creating an environment for myself that kind of hits all of my main areas. I would say, like, I love spending time with my family and friends, but then like I don't feel right mentally if I don't work out or just move my body. So if I don't stick to my routine, which I'm still developing, I'll just go on a walk, and just spend some time in nature. That's the beautiful thing about being in LA. We have a lot of free access to stuff, or in any space really where you have a lot of nature that's not so industrial. So Yeah, but I guess we can talk more about like my specific routine that I like to do, but that's pretty much it. Just like
I like the way
discipline,
you
reflection.
explained that, and that is so
Thank
true.
you.
When you are, as a young person, and like you say, you've been in school, and then after high school, you go right into college.
Yeah.
You're an athlete. It's to show up for practice at this time.
Mhm.
The game is going to start at this time. Classes start at this time. So that's been set up for you. But once that's said and done, now is who's waking me up, or what am I getting up for?
Yeah.
Why did I have to be at this place at this time? But now it's on me.
Yeah. It's not easy. And it's not easy for all my student athletes out there, all my former student athletes. Like, I see you, listen, it is hard. It is hard out here. And it is nice because a lot of my former my teammates and stuff, like we all talk about it and we all kind of have that same understanding. So yeah.
Yeah, if there's something, I'm trying to picture in my mind what that even looks like to prepare, just what you're speaking to. I know that it's gonna reach and resonate with somebody, because you don't
Right.
know. If you haven't had those discussions or even thought about it yourself, you don't know until you're in it.
Yeah.
That level of discipline.
Mhm.
Now you're in full control of what life looks like after someone has set those
Yes.
schedules and times for you. So we're gonna come up.
Okay.
That's a good time. I'm just thinking that's something
We need to have another discussion about that, like with other
yeah,
student
because
athletes.
that's
Yeah.
important to
Yeah.
try to prepare individuals, whether they're athletes or just in school academically, but before they get to that point,
Mhm.
prepare for that. Start working towards
Yeah.
that before
Yeah.
it happens.
Absolutely.
So now we're just massage specific. So I know
Yeah.
I've already complimented your skin, and we had a
Thank you. Oh,
conversation
thanks.
before we started recording about the inside out,
Mhm.
and how important that is, what we're putting in our bodies, and even how we're thinking and feeling, and just gratitude,
Yes.
day in and day in.
Mhm.
So my question for you, where massage therapy is concerned, do you
Yeah.
receive massages? Do you get?
I need to. And Natanya has been on me about that. She says, when you coming in? And I need to. I have gotten one. I have gotten one or two in my life, and it was great. Like, I feel like I got a little nervous system reset. I do like respond really well. I just haven't scheduled it. So that's just something that I'm gonna do. And I actually hold me to that, because I have the next couple of weeks off. I have 2 weeks off to just kind of like organize myself and my business, and taking that time for self-care. So, and it's good to be in tune with my body enough to not just take the 2 weeks off because, oh, I need a break. This was planned. So I kind of could see how things were going. So I said, let me take some time off to organize my business so that I can be better, for myself and for my patients, and just to take a break. So I will get a massage during that time. I'll let you know.
I highly encourage you to
Thank
do
you.
so. I love massages. I get them often. If I could
Yeah.
massage, I mean, I can self massage, where we all
Right.
get certain areas on our body, but there's nothing like actually getting on the table
Mm-hmm.
and just letting it all go, just relaxing.
Mm-hmm.
Yeah, you gotta.
I know.
I'm just always curious about other professionals, and if they actually take time out to do massages. But I'll do Thai
I
massage.
know.
I'm open to doing like
Oh, shoot.
every kind of massage there is to do. I'm
Yeah.
gonna do it.
I like the ones with aromatherapy. Like,
Oh yeah,
that's really nice.
yeah.
Mm-hmm.
For sure. Aromatherapy massages are good, and Reiki is energy, so not exactly a massage, but one of my good friends did a Reiki session offering with me. Her name is Jackie, in LA, and it was one of the best experiences I ever had. Played the sound bowls at the same time, like before. It was just amazing. So I would say you also try that as well if you want to
Thank you.
the energy healing. Reiki is something I would definitely recommend. Just so you're always feeling your very best and what you're
Thank you.
doing for your clients and patients. So let's see. You're young, doing your thing. Congratulations on staying the course,
Thank you.
first and foremost. Congratulations for that. And I wish you all direction, just some key things that could make the difference of quitting or even just postponing something, just stop, just advice you have to just keep moving forward.
Yeah, absolutely. I'm gonna just say the question back because I think that you cut off for a second. The last part that I heard was basically I just heard basically obstacles that can get in the way. Is that what you said? And
Yeah,
then advice for how to move forward. Were you asking specifically for my obstacles or just in general
just
advice to move
what
forward?
well the advice or any guidance you want to give based on your experience, someone who may be on
Yeah,
the journey that you
gotcha.
yeah, so they can continue to move forward with it.
Gotcha. Yeah, someone who might be interested in any of the things we talked about. Oh,
Yes.
yes. Okay. Ooh, yes. Number one is have a good support system. If you don't have one right now, start to develop your support system. I have classmates who don't come from large families. I mean, I don't come from a large family. I'm the first one on my mom's side, or yeah, in the family in general to get a doctoral level of education. And what that means, it's not just, oh, to, excuse me, just to have a degree because it sounds nice, but it really takes a different level of understanding and of your time. And, if I didn't have the support system that I had through my parents and through my friends, friends is a big one.
Mhm.
Friends are a big one because when you're on this journey of doing anything difficult, it doesn't mean even pursuing a degree. It could just be something that you're going through. If you have friends who aren't on the same wavelength or who can't respect, hey, I might not be able to go out at this time, or I need to be in bed by 10 o'clock. And they're not supportive of you, that can kind of be a distraction. So I have great friends that were supportive of me having to do things a little bit differently in order to stick to the plan. So I would say that the support system is the biggest thing. And another one is if you have a setback, which most people will, I definitely had one where I got like burned out and I just wasn't in a place clinically that I thought I was in a place clinically that I wanted to be, and I'm in a better place now. So
Mhm.
just allowing yourself to giving yourself grace for changing. Like it's okay. Like the person that you thought you were at 17, like you don't have to be that person at 27 or 37. So I feel like that's a big lesson that I learned because I had my life all mapped out and it just doesn't work out that way. And I just kind of allowed myself to change. Like I didn't even think last year that I was going to be doing mobile physical therapy. So but the change that happened was me, I guess, working on myself and realizing, hey, it's okay to change. Like it's okay to not know. So I would say those are the main things, like support system, and then giving yourself space to change, and then understanding that things will get better, even if it seems like it's not, as long as you have gratitude and just stay focused and focus on yourself and what makes you feel balanced versus what you're trying to get, because what you're trying to get will come from the inside out, what we said earlier. Yeah.
Yeah, absolutely. Yeah, that support is huge. And young people sometimes it seems like, parents or, family can be coming on you kind of hard.
Yeah.
It's out of love. I don't know if you remember Elijah or
Yes.
not. Okay, so Elijah and another good family friend, Melissa, they recently told me or expressed to me that, hey, at that time, we didn't understand,
Yeah.
but they thanked me for
Mm-hmm.
the guidance and the love, the hard love, what it seemed like that I
Mm-hmm.
was displaying, because like you made a good point, knowing when to say, no, I have something else to do, or no, I can't go.
Yes.
That was the main thing I would tell
Yes.
Hill, Elijah, all of them,
Mm-hmm.
especially playing sports,
Mm-hmm.
having those goals, to know when to say no. You need to
Yeah.
know when not to open the door to the dorm just because
Right.
you have other things going on.
Yeah.
Had to tell people I'm not available or no, I'm. So I
Mm-hmm.
appreciated that. I recently got that call and it made me feel good.
Oh.
In their adult life, they get it, they understand it, they understand the value that was in that. So I'm glad that you pointed that out, because that makes a difference, and you're gonna grow, and it's okay. you know,
Yes, that's the part right there. And it's okay.
it's okay.
It's
All
okay.
right. So let's see. In your environment, if you just what as far as clients,
Mhm.
and they come in, like you said, different reasons.
Right.
Do you ever tie in or connect things that could be going on or limiting that
Mhm.
movement where emotions are concerned or environment are concerned? Is that something that comes up in your practice as well?
Yes.
Okay.
Yes, I consider myself to be a trauma informed therapist. So I do a lot of nervous system healing, nervous system recovery. And this is something, it's funny, we didn't even talk about this, but I know that you would appreciate this. So I learned a lot of that at this clinic where I worked when I first graduated, reactive physical therapy and wellness. And I did a lot of shadowing there when I was like in high school and in college. So I learned a ton there about just the nervous system and chronic pain, the connection between brain and body, and autonomic nervous system healing. So yes, I definitely try to incorporate a lot of that into my clinical practice now. And for some patients, it's just necessary. Anybody that has chronic pain, we're doing some type of nervous system regulation. People that have POTS or connective tissue disorders, we're doing that. So whether it be, nervous system healing through it's whatever they need, really,
Mhm,
but it could be anything to regulate the nervous system, meaning like breathing techniques or compression using like sensory tools.
mhm.
If you look in my back seat, I have this box, and it's if somebody tried to ever break into my car, they'd be like, "What does this girl do?" Because it's a blood pressure cuff, but then it's balloons, it's straws. There are different things that we do to keep techniques externally focused, meaning they're not thinking about what their body's doing, but
Mm.
they are paying attention to their external environment to kind of quiet whatever's going on in their body.
Oh, nice. And yeah, I had no idea.
Yeah.
I was curious to know if
Yeah.
that's something because a lot of times, and just depending, but when you're working with someone on their healing journey, if we're going back to an environment that caused whatever is going
Mhm.
on, it kind of does us a disservice at times. So
Absolutely.
yeah, I was just curious about that.
Mhm.
So we kind of covered most of
Yeah.
what we discussed. Were there any other
Mhm.
things that you wanted to highlight or bring about?
Let me see.
And I definitely want your you can give your Instagram
Absolutely.
contact information.
Mhm. Yes. Let me see. PT community. Oh, yes. So you said PT. So you gave me a question before we started about PT being physically demanding. How do you protect your own body? And I just want to just speak to the audience here for any of my healthcare professionals that use your body. You want to make sure you're protecting your own body. So I definitely still weight train. So lifting is good. Just doing some general mobility and body mechanics are big for just taking care of yourself, because it doesn't feel good when you don't feel well and then you're working on someone else. So just some type of movement that you can stick to consistently is what I like to do. And also internally too, protecting your own body and protecting your own mind, especially when people are going through a lot. And right now we're in a very strange climate just overall. So a lot of my patients aren't really mentally well. So just taking the time to connect with them and then just be human and providing a space that's not only healing their body but letting them know that we're kind of all in this together is helpful, and for giving them specific strategies, or just having a session where we don't talk about anything else aside from joy and having fun. That helps too. So
I
yeah,
like
that's
that. Yeah, I like that. Because yeah, we
Mhm.
can't. This came up on the last conversation I had, but pouring from your overflow. And so sometimes,
Mhm.
even as professionals, if you're not doing that, then you're not giving your client the best of you.
Right, right.
Um, and not just your clients, but just your family, your loved ones. So we have to be aware of that and find things and groups
Mm-hmm.
that we can be a part of. And that's another thing. We are going to be starting back our sister circles next month.
Mm.
And it's for all, for women, um,
Yeah.
just to get together and be able to speak and be in a safe place and come together in sisterhood. So I'll be posting about those in the near future as well.
Yeah, I have to tap in.
Oh yeah, for sure. For sure, because they are very helpful. Let's start off with guided meditation and breath work.
Oh, yes.
Yeah, so I work with a lot of really good sisters who have done the work, um, and are just in that space of being able to share and help other women on their journey, just to where healing is concerned. Like you said, just the whole body, our emotions, making sure we're keeping our nervous system regulated, our
Yep.
thoughts in the right place, because a lot of times we're fighting against ourselves
Yeah,
and just need to have other people that we can, trust and talk and get that good information from. So,
absolutely. Oh
but
my gosh, I love that. I'm so proud of you. Wait.
yeah, thank you. Yeah, so just this is the part. So with the whole name Body and Mind Solution, you get the components, the body, the mind, and just having solutions for how we move through this place.
Mhm.
And not just in massage therapy, that's that physical aspect of doing that work, but just the other things that I've been waiting to introduce and do slowly over time. So yeah, I'm happy to be here in this space. I've been doing some writing in one of the local newspapers here and their health, doing health articles. So that's been great, just to highlight other professionals, other people that are doing things in the community. So I'm happy to have you.
Yeah,
And
I'm happy to be here. Thank
yeah,
you.
some really good information and continued success on your journey.
Thank you so much. And I
Yes.
hope to be back again soon, maybe for a student athlete kind of group session or something,
Yeah.
because I think that conversation is definitely needed. And with identity and mental health, all that, most student athletes that I know had a somewhat tumultuous time with that transition. So, yeah.
Absolutely. So yeah, we'll definitely plan something else, but give us your information, contact information, social media,
Yes.
so that people can find you.
Yes. Okay. So I had to pull it up because I was like, what's my username? My username for social media is my first and last name. So Adili, last name Rikonja, Rikondja .pt. So it's just my first and last